Dr. Mike mentioned in his recent video that he's considering a beard hair transplant. He also said that he'd like to make a video about the process.
I'm thinking about getting it on my face for a bald spot on my facial hair.
Is it this one right here?
Yeah, I don't know which side it's on. It's like, there's like a hole somewhere.
Interesting.
Because I want it to be like, you know, that's why I want the fullness.
So let's see if Dr. Mike would be a good candidate for a beard hair transplant. We asked you guys if you thought that we should reach out to Dr. Mike to offer him a beard hair transplant. You said yes, so we did. When I look at these photos of Dr. Mike, what I see is that he has very strong scalp hair. When a patient considers a beard hair transplant, it's important to have a full discussion about medical therapy for their scalp and for the potential of improving their beard with the medical therapy. We have a weekly newsletter that covers different hair restoration topics, and every single Monday we send this out and people are learning a lot. We have over 1,500 people who have subscribed to the newsletter and they're reporting that they really love it. Head to hairlinesnews.com and subscribe to our free newsletter. Remember that the donor hair that typically comes from the back and the sides of the scalp is limited, and it's that hair that we would use to transplant the scalp in situations that warrant it. So you want to make sure that you're budgeting that hair appropriately. And that's why it's important to remember that medical therapy will help preserve your scalp hair so that you don't run into a situation where you've invested a ton of grafts into the beard and now you realize that you would have preferred to have those hairs placed on your scalp instead. The other point I'd like to make is that medical therapy can also help for the beard in some instances. So minoxidil, for example, whether applied topically or most of the time I prefer it as a pill, can help partially restore beard hair as well. So now looking at Dr. Mike's beard, what I'm seeing is that he has a moderate hair density throughout most of the beard. He has a missing connection between the mustache and the cheek and goatee areas. And he has reduced hair density at the medial cheeks on both sides. As far as graft estimates go, from the mustache to the goatee cheek connection, and for some upper goatee improvement, the plan would be for about 300 to 600 grafts on average. In beard hair transplants, it's important to stress the following elements, and that includes density of the hair, angulation of the hair, as well as the graft size and distribution of the hair that's being placed. Now, when it comes to density, it's important to keep in mind the distribution of that density throughout the beard area. If you have an area that already has a good amount of hair and you're increasing its density by placing grafts in there, and then you have an area that's completely bare and you're starting to work grafts into that area, you'll likely have a discrepancy of your overall density. Then you have the angulation of the hair. The hair that grows in the beard usually is angled fairly acute to the face, meaning that it's not coming straight out. So the way that the recipient sites are made and the way that the blade is angled is critical for creating a more natural result, because you want the transplanted hairs to match the angulation of the pre-existing hairs in that area. Also, the graft size and the distribution of the different sizes of grafts is also very important. So if you have single hair grafts, those are good around the perimeter of the beard, especially at that upper cheek area, so that you have a gradation from where the hair starts along the upper cheek to the more dense areas as you get into the middle part of that beard. And so that's why you select the single hair grafts for the outer perimeter and the heavier grafts such as your 2, 3, and 4 hair grafts into the body of that beard. I'd also like to say that you have to keep in mind alopecia areata, which is the condition that I have. I have the more severe form, as you guys know, universalis, but alopecia areata usually comes in these circular patches. So some patients will get this patch that forms, and usually it's a temporary type of patch and it'll fill in over time. But if you start to transplant that patch very early on, what you might find is that the hair doesn't survive because of the acute inflammatory state of that site. It's much better to wait a minimum of 2 years to assure stability of that area before considering a transplantation. So in Dr. Mike's case, we looked back over the course of several years, back to 2020, and it looks like those sites, especially the medial cheek areas, have been stable over time. So that gives me more confidence to potentially transplant those sites. So let's say Dr. Mike was interested in filling more than just those areas around the mustache to goatee and cheek areas, and more than just those small areas in the medial cheek. Let's say he was looking for an overall bilateral cheek and goatee density improvement and a shape up to the whole beard area. In that situation, the plan for the number of grafts would of course increase to about 1,400 up to even 2,000 grafts plus. In performing a beard hair transplant, usually I like to make the recipient sites first. The reason for that is we want to be as accurate as possible when it comes to harvesting from the back of the scalp, because again, we want to preserve the donor area as much as possible so that if we need to later on use grafts for the scalp, we have a supply there to do that with. And that's why once we make the sites, let's say we end up making 1,800 sites along the beard for, say, Dr. Mike or any patient, then we'll go to the donor area and extract exactly that many grafts, typically with the FUE method, so that we have a really good match between the number of sites and the number of grafts that we need. And that's actually one of the advantages of doing FUE technique over a strip or an FUT approach. Not only does the FUT approach give you a linear scar, which many patients, especially male patients, are looking to avoid because of shorter haircuts, but also you can't exactly know how many grafts are coming out of the strip until your team starts to dissect it under the microscope. And most patients with the FUE approach have about 5,000 to 6,000 grafts to give from the scalp donor area over time. And what that means is that it's not only that they have 5,000 or 6,000 grafts in the back of the scalp. What it really means is that after you've extracted that number of grafts, the back of the head starts to look thinner. You start to appreciate that reduced density because you've started to now impact at least 50% of the overall grafts on the back of the head. And so some patients will ask me, well, I don't want to use my scalp hair as a donor area for the beard. Can we use any other sites? Can we maybe use hair on my chest or pubic hair? We even get asked about. And the reason you don't want to use that hair is because the hair on the head, 90% of it exists in the anagen phase, which is the growth phase of the hair cycle. And that's a much higher percentage than any other area on the body. Once you start getting into like the neck, you're looking at more like at a 70 to maybe 80% of hairs existing in anagen. And that percentage decreases the lower you go. So as you start to get into the chest and the back, the number drops. And it's for this reason that we prefer the scalp hair as our donor hair, because the odds of it growing, the odds of it succeeding in the new location is much higher. Now, patients who get beard hair transplants, or really any type of hair transplants, will sometimes find that, hey, I really like my results and it definitely helped, but there's still some areas that can use some additional grafts, or I want to bump up the overall density of the result. That's not uncommon. Usually that's about 15 to 30% of patients that actually choose to get additional hair transplants. Now, that doesn't mean that the initial surgery was a failure. So touch-up procedures shouldn't be seen as like, something bad happened, but rather it should be seen as something that fairly often occurs and can be used to additionally bring in more grafts to create an even more robust result. Now, some considerations when looking into a beard hair transplant. One is like your goals. What are your goals for the results? What do you hope to achieve out of this? I think having clear goals and communicating them well to your physician is super critical. And it's also equally as important for your doctor to absorb those goals and then devise a strategy that tries to address those goals. Now, the second thing is, of course, the cost. Every clinic charges differently. Some charge by the graft, some charge by the case. And so making sure that your budget aligns with the clinic that you're selecting is very important. Now, we should also stress that there are risks to beard hair transplants along with really any surgery, right? What I tell people getting any kind of hair transplant is the most dangerous part of it is the lidocaine, which is the numbing that's used during surgery. If your team doesn't track the amount of lidocaine that's used and the quantities and the concentrations, you could run into an issue of lidocaine toxicity, and that could be very dangerous. And we have a video about risks and complications of hair transplants. Make sure to check that out. Now, one particular thing when it comes to risks when we're talking about beard hair transplants is cobblestoning. Cobblestoning is this interesting phenomenon that occurs primarily in the goatee area. There's something unique about the skin of the chin region that after a hair transplant, even with great technique, you could get these little protrusions, little bumps on the skin surface, even if the hair is growing in. There are techniques on the transplant side that try to minimize the occurrence of cobblestoning, but that's something that is very unique to this lower sort of chin area and something that should be kept in mind when people are choosing to get transplants into that region. Now, when it comes to recovery from a beard hair transplant, similar to scalp hair transplants, one should expect swelling, some degree of discomfort, but the biggest difference in terms of the instructions that we give patients for beard hair transplant compared to scalp is that they should keep the area dry for 6 days. On the 6th day, it's okay to get it wet and to shower and to start to work out the crust, but we prefer to keep it dry. And again, that's because of the angulation at which we place the hairs. And it's the same for eyebrows as well. We don't want beads of water coming down and potentially wiping out the grafts, especially in the first 3 days. And also, of course, future scalp needs, right? So you want to make sure that you have a plan for your scalp hair and that you don't continue to lose that, because remember, limited donor supply, you're investing grafts into the beard. So now what happens if like 10 years later you start to lose some of your scalp hair? So being on proper preventative medication and monitoring the scalp is really important when you're seeking out a beard hair transplant. If Dr. Mike decides on a beard hair transplant, I will gladly welcome him into the practice, and I think it would be great to educate the public on this type of procedure as well as hair transplants in general. And that would be a really cool experience. We've reached out to Dr. Mike on Twitter. We'll see if he replies. Since you enjoyed this video, check out our showcase video on beard hair transplant. Click on the card, we'll see you there. Also, subscribe and turn on all notifications.